Today, I'm going to teach you the very absolute basics in anatomy that you cannot do without. This terminology is used everywhere in anatomy and you have to know this to learn anatomy. In this video, we are going to discuss the anatomical position, anatomical planes, anatomical location terminology, and embryological terminology. The position of things in our bodies vary greatly as we move about in different positions, which make it difficult to describe the structures in our body in relation to each other. For example, if I say my head is above my neck, that's not always true. Therefore, anatomists have come up with a default position called the anatomical position, and all the structures are described with respect to this position, the anatomical position. If you're feeling bored and sleepy, try doing this along with me. First of all, get your lazy butt off the chair and stand up. Extend your arms. Make sure you're rested and your arms hang down to your hips. Move your hand to a position where the palms are facing forward, like this. Keep your feet together and your toes should be directed forward. Keep your head straight. Well, now you should be in the anatomical position. Alright, now sit back down. There's a lot more to learn. Everything in human anatomy is described in this context, unless they have stated otherwise. Alright, moving on to anatomical planes. There are three commonly used planes. The body can be cut in these planes. The sagittal section, which divides things into left and right parts. Coronal section, which divides the body into anterior and posterior sections. And the transverse section, which divides the body into superior and inferior parts. Anatomical location terminology. Although we decided on the default position, there's no longitude and latitude system to describe points in the body, so everything is described in relation to one another. And for that, we use a set of terms that you need to be very familiar with if you want to learn anatomy. Superior versus inferior. The head is superior to the neck. This means that the head is above the neck. The mouth is inferior to the nose, which means the mouth is below the nose. Anterior versus posterior. Anterior means in front. For example, if you say the sternum is anterior to the heart, that is correct. Posterior means behind. So we can also say the heart is posterior to the sternum. Medial versus lateral. This is usually described with respect to the sagittal plane. Things closer to the midline are medial, and things that are more away from the midline are described as lateral. Proximal versus distal. Alright, this is a tricky one to explain. This is described with respect to a certain point, usually when describing appendages, tubes, and elongated structures. For example, if you take the upper limb, the structures on it can be described by relating to the starting point of the upper limb, that is the shoulder joint. So you can say that the elbow is proximal to the wrist because the elbow is closer to the shoulder than the wrist, and the wrist is distal to the elbow. If you think you won't remember it, don't worry. You'll get the hang of it pretty soon as you learn more anatomy, because it's literally used everywhere. Moving on to the last part, embryological location terminology. The terms used to describe the structures in the embryo are somewhat different to the human terminology, and it is actually more similar to the terminology we use to describe structures in animals, because it's only after birth that the humans obtain position. In the mother's womb, we are developed curled up like an animal. Ventral versus dorsal. This is somewhat similar to anterior and posterior relations. The front of the embryo is termed ventral and the backside is dorsal. For example, the umbilical cord lies ventrally. Cephalic versus caudal. Cephalic or cranial refers to the head, so structures that are closer to the head of the embryo can be described as cranial relative to another. For example, upper limbs are cranial to the lower limbs. Caudal refers to the tail, the butt. When you describe structures in neuroembryology, the word rostral is used, because it doesn't make sense when you say cranial or cephalic when you are describing the location of structures within the head. You can check out all the labeled diagrams I draw for these videos on my Instagram page and complete descriptions of diagrams in the caption. I also post daily quiz on Instagram called Brain Scavenge, so follow me if you want to stay in tune for that. And I will post more videos like this in the future on YouTube, so if you're interested, subscribe, and click the bell icon to get notified of new videos.